The latest news, updates, and more from the world of health and medicine. This is Medical Minutes with Wish TV's medical reporter, Dr. Mary Gillis.
From Wish TV, I'm medical reporter Dr. Mary Gillis, and this is Medical Minutes on the All Indiana Podcast Network. The NCAA tournament is in full swing, and it's a great time of year to sit back, relax, and watch the games. But March Madness also happens to coincide with a certain medical procedure. This week, we spoke with Dr. Ryan Berglund, a urologist at the Cleveland Clinic, who's been studying the link between what some call the swish and snip for almost a decade. Our conversation is next. Here in our newsroom, I'm so excited to have Dr. Ryan Berglund from the Cleveland Clinic, who has been studying a very interesting area of research for a while now. So, Dr. Berglund, welcome.
Thanks for having me on.
Okay, so what is this line of research that we're going to be talking about today? I know it sort of is linked to March Madness and some sort of and men's health.
Yeah, it's interesting. This is a time of year where guys like to have a lot of free time to be able to watch the big games. And it also happens to be a time where a lot of our patients were getting vasectomies. And a few years ago, we made the connection that getting a vasectomy was a time that guys could have a little bit of free time where they're free to just sit on the couch, because that was expected for their recovery from getting a vasectomy done. So a few years ago, we noticed there was an uptick in vasectomies during March Madness. We started talking to our patients, and lo and behold, a lot of them were using the guaranteed off time that they had with their vasectomy to watch their March Madness.
That is so interesting. And so, I mean, when you did this research, was it just something that you happened to find a link? Did you ask these patients sort of just wondering, I don't know, or did you do a questionnaire? What was the way in which you conducted this research?
With a lot of research, the first thing that happens is you notice the correlation. You just started to notice, gosh, just like today, I was absolutely swamped with vasectomies. And so we started noticing this happening about this time of year. And then we'd have patients come in and kind of express their appreciation, not just for the vasectomy, but for the free 2 or 3 days they had to sit on the couch to watch the games. So we just started looking back at our records. So in addition to the patients pointing this out to us, we, lo and behold, noticed that there was a large uptick in vasectomies that occurred in March.
Mm-hmm. And we're not saying that men will get a vasectomy because it's March Madness. They already have intended to do this anyway.
Correct.
I don't think they'd go to that extreme if it weren't necessary.
Maybe a few guys, I don't know, but most no.
Who knows? I know, right? To each his own. So how long is this recovery? Are we kind of milking it a little bit here? Or what do you think?
What I tell my patients, number one, I do want them on the couch for at least 2 days after the vasectomy. They can get swollen, just like with any other surgery. Most patients have 7 to 10 days of aches and pains, and after that, they're usually okay. But there are outliers. There's some patients that take a little bit longer to recover than others. So, but in general, it's 2 days on the couch.
Okay. So they can submit, I think they can submit a doctor's note that this has happened and that it's required medically that they lay low, they stay home, and because something could go wrong after they want to be monitored closely. So can you speak to that? Is that something that they could get and sort of as validation that this is essential, that I really need to stay put? And then, you know what, you've gone through something that, is painful, so you deserve a reward, I would say.
That's exactly right. What we've seen is that, most patients will need a work note. We have a lot of these done on Fridays, just so that patients can take the weekend to recover. But we do ask patients to take a couple of days on the couch. Not doing so can interfere with their recovery. And so that's just a standard part of the recovery. You're going to need it no matter whether it's the, March Madness, the Masters, or it's just some random weekend. But the correlation has been if a patient knows they're going to need to get this done, why not have it done on a weekend where they'd want to be watching the big games?
Mm-hmm. Well, I'm wondering if they're maybe, I don't know, this around the Final Four. I don't know if it's the whole 7 to 10 days, but maybe scheduling it close to the Final Four. I don't know. That just came to mind. And then, I mean, were you surprised by this? I actually kind of went on the street today just to ask people, if they could consider, this is something, and they were actually very like, oh no, I understand. I understand that this would happen. What are your thoughts?
It's not unique to March Madness. March Madness is the big one, but we also see a bit of an uptick. I've noticed this at least around the Masters. That's always that's a popular one as well. I think it's one of those things where it's a purely elective procedure. So because there's no urgency to it, you can schedule it around the time where you're going to want to be sitting around on a couch anyway, watching TV. So it works out nicely for the patient.
That makes so much sense. This is actually a really interesting thing that you've discovered and found here. And you're saying this week you've seen a lot of patients so far, or at least recently or today.
It's funny. I'm never really looking for it, but I always notice an uptick this time of year, and I think about it for a second, and almost immediately, oh yeah, it's March Madness again, or it's
okay.
It's the Masters or whatever.
Okay. Well, will you be watching the games?
I'm still trying to catch up right now, but yeah, I've been watching a little bit of the fun.
Okay. Who are you rooting for?
Cleveland State, of course. They're my team.
Nice. Yeah, very cool.
Being in Cleveland, right? Yeah.
And it's what?
Being in Cleveland State, of course. It's exciting.
I hear you. I actually think we have sort of this thing going on at the station, and I had bracket or something, and I put Cleveland. I don't know. Yeah. That was
bold.
Huh? Why?
That was bold. Yeah.
Okay. Well, any other thoughts that you want to talk about in terms of this research?
Really, it's this is a purely elective surgery. It's a very effective form of birth control. So if patients are looking for what I would consider to be an irreversible form of birth control, this is about as good as it gets. But it's also an elective procedure. So there's no urgency to get this done. This can be work around people's schedules. And the interesting thing is that if there's a point in time where someone wants to have a little bit of time to sit on the couch and watch some TV, it's a good time to get your vasectomy done.
Dr. Berglund, that makes so much sense. Well, I want to thank you so much for joining us. Really appreciate it.
You're very welcome. Thanks for having me on.
This has been Medical Minutes from Wish TV. I'm medical reporter Dr. Mary Gillis. Be sure to follow and subscribe to this podcast and check out new updates every week. You can also learn more at wishtv.com and when you follow Wish TV on Facebook.
Learn more and get more with Wish TV. Online at wishtv.com and when you follow Wish TV on Facebook. Be sure to check out more great podcasts from the All Indiana Podcast Network now at allindianapodcastnetwork.com.